Hello everyone, this is dr.simantini, practicing dermatologist, and I like to make educational videos on skin and hair. Today we are going to talk about fungal infection of the skin. So in this video we are going to discuss about what are the reasons that you get this infection, what are the reasons that you get reinfection or the recurrence, and different ways to prevent it. The fungal infection has become a significant health problem. It is seen to infect many family members within one family. Now, it can be frustrating to many patients because the treatment may take a longer duration, or it can be also very pricey. For example, these tablets or creams can be expensive because you have to apply them for a longer duration. So what do patients try to do is they tend to give up. They tend to stop applying the cream. As a result, we get higher chances of patients coming up with reinfection or recurrence or the relapse of this infection. Many times patients visit pharmacies and they try to get this over-the-counter products. These over-the-counter products sometimes contain steroids. So what the steroid creams will do is they will try to mask your infection. That is, you feel better for few days because your redness goes down, your itching goes down, but then the infection comes up with a bigger flare. So the infection is more severe next time and affecting many more areas. In addition, when you apply the steroid creams, there are a lot of side effects because of the steroid creams. Like patient tends to get thinning of the skin, striae tends to develop, and also the hair growth, especially if applying the steroid cream on the face. So these can be some of the dreadful side effects. So fungal infection, also called as a ringworm. So it's a very superficial infection of the skin which is caused by a fungus called as dermatophyte. Now this fungus likes to thrive in the superficial, that is the topmost layers of the skin. Now let's see how this fungal infection looks or how it appears. Usually there will be round patches, round patches. Either they will be red in color or black in color, and they will have a very active border. That is, at the border, at the margin of these lesions, there will be boils, there will be scaling that will be seen. So these patches tend to expand. And there will be some amount of inflammation. So these patches may become more red, or you may get pus containing boils at the margins of these patches. Also, there will be severe itching associated with these lesions. Now let's look at the sites that are usually affected. Because this fungus likes to thrive in the moist areas, usually the body folds are affected. For example, your armpits, groins, under the breast in case of females, between the toes. So these are most commonly affected sites. But it can also affect other sites such as your legs, arms, trunk, that is the abdomen or the back, including the face. Even in I have seen patients coming up with a fungal infection inside the ear. Also, it can affect the palms and the soles. So these are the other sites that can be affected in addition to your body folds. Now, let's look at the factors which are causing this fungal infection. The first and the very common is the sweating, that is the moist area. So a person who tends to sweat a lot, has higher tendency of getting fungal infection. Second is the climate. We get a lot of fungal infection patients during summers, that is when it is very hot and humid, as person tends to sweat more. Also, it can occur during monsoons, because again you tend to get wet. So the moisture is one that the fungus likes, isn't it? So that's why you can get it more during monsoons. Also, patients tend to wear half-dried clothes or clothes which are partially wet, which can also trigger the fungus to multiply. Also, it depends upon the condition or the environment in which you are living. Like suppose if there are too many people living in one rooms, then also the fungus tend to spread from one person to the other through the fomites, that is through the bed sheets, through the clothes, through the towels or the soaps. So that's how the fungus spreads. And wearing of tight clothing such as tight denims or any other tight clothing can also worsen it. So it's better to wear something very loose and comfortable clothing, especially during the hot and humid climates. Next is if you have any other underlying medical conditions, for example diabetes or any other condition which lowers your immunity, so the fungus tend to multiply or thrive more. Okay, also certain medications, for example there are certain people taking oral steroids or oral immunity suppressant medications for many medical illnesses. In such patients also you can get fungal infection. So once you get a fungal infection, it is better to get the treatment from a proper dermatologist, that is a skin specialist. Okay, do not go to the pharmacies and buy over the counter products. It is better to treat this fungal infection early with a proper regimen. Okay, so the duration of the treatment which the doctor prescribes to you, you have to follow it. If you leave the medication halfway, then there are higher chances of you getting a relapse or a resistance. Okay, so next time when we give the medication will have to be given for a longer time. Also, please refrain from going to the pharmacy and asking for the tablets or creams, because majority of the times the products that are dispensed without prescription contain steroids or they contain any other ingredient which may worsen the condition. So for example, if you are given a cream which contains steroid, temporarily you may feel better because it has steroid in it, so it will try to lower the redness part of it, the itching part of it. But then when you stop applying the cream, okay, the inflammation may come back, the infection may come back, and it may become more resistant then. So next time when we treat the patients, the medications will not work. Okay, so it's better to take a proper course of treatment. Now what the dermatologist will do is they will evaluate your history. So if you are taking any medications, for example any other BP medications or medications for your diabetes, these will be evaluated and accordingly your treatment plan will be modified. Okay, so the duration of the treatment, the dose of the treatment, the kind of medication will be decided by your dermatologist. Also, if you have gone to a previous dermatologist or if you have taken any previous antifungal treatment, then it is better to bring it with you, the documents or the prescription, when you consult your doctor, because the doctor can then review and see which medications have actually worked for you and accordingly decide the next step of treatment. So when a doctor prescribes a medication or a course of treatment for you, do not leave it halfway. Okay, because doing so what happens is you're taking the medicines for a shorter duration, shorter than what was prescribed to you, then you may get a resistance to it, so the next time the medication will not work. Okay, so it is better to complete the course of treatment that is given to you. Now there are a lot of patients I've also seen when there are many other family members that are infected. So all the family members, those who are infected, should get the treatment and get themselves treated at the same time. Because what happens is when you treat one person, but if the other people are not treated, then the infection tend to get passed on. Okay, so there will be reinfection in that case. So that is how many patients come up with reinfections or relapse, because the other family members are not being treated properly. Now these were some of the important treatment guidelines that you have to follow when you get a fungal infection. But there are also some of the skincare practices that you have to do in order to minimize the reinfection. First is taking bath twice daily, especially if you sweat a lot. So when you are going to the gym or suppose you are coming from your work, it's always better to take a bath after you return from your work or from your gym. And keeping your soaps, your clothes, your towels separate from the other family members, those who are not infected, as you may pass the infection to the others. So after you are done with your bath, you have to wipe yourself completely. Do not allow any moisture to remain, okay? So it is important to pet yourself completely dry immediately after bath. Okay? Do not stay in the wet towel for a long time. Then use a soft cotton towel. Okay? Do not use any of those harsh towels. And try to wash your towel daily. Then you have to change your clothing every day. Do not repeat your clothes. Okay? You have to wash your clothes every day. Preferably you can soak them, your clothes, your undergarments, your towel, in hot water prior to washing it. Okay, and your clothes have to be soaked separately. Do not mix your clothes with the clothes of those who are not infected. Okay, now after you completely pat yourself dry, you have to apply the antifungal cream. You start from the margin of the lesion, that is the patch that you have got, and you have to move 2 centimeters around. And you have to follow this method when you're applying the antifungal cream. Then you have to preferably wear iron clothes, okay, which are clean. Your clothes should have to be air dried, sun dried preferably, and ironed, including your undergarments. And keep your nails short at all the times, because the moment you scratch the infection, there's a chances of you transferring it to the other area and or to any other person, because the fungal elements can hide under your nails. So keep your nails short, and then it's always better to wear a loose clothing. Avoid any tight clothing such as jeans or leggings. Okay, you wear loose cotton clothing. Also avoid any synthetic wear. For example, if you work out, then you have to wear sweat absorbent clothes. Okay, so there should be some amount of ventilation. So loose cotton clothing is always better for daily use. So to conclude, I would like to say that please take a proper course of treatment from a certified dermatologist or a skin specialist, and follow the proper duration of the treatment. Complete the course as prescribed to you by the doctor. Now the course of treatment may vary. Sometimes it may be just 8 weeks, or it could be even 12 weeks. Okay, so you have to follow as the doctor has prescribed to you. If you do not feel any improvement, or if you feel that it has come back again, please go back to your doctor, because there will be a next step of treatment that the doctor will prescribe to you. Then also important to follow the good skincare practices. Okay, and treatment of all the family members at the same time is also essential. So I hope all these steps will help in preventing the fungal infection or treating the fungal infection. I hope you found this video useful. I make such educational videos on skin and hair related issues. If such content is of interest to you, then please subscribe to my channel and stay tuned for more videos. Thank you.